Howdy, Aggies. My name is Dr. Stephen Martin, and I am a clinical associate professor in the Health and Kinesiology Department. And Courtney Bassett in the Flourish program at Texas A&M asked me to talk for a few minutes about the ongoing controversies with wearing a mask versus not wearing a mask, specifically while one is exercising. We all have seen the debate going back and forth and seen different information, sometimes confusing, coming from various organizations such as the World Health Organization and the CDC with regards to wearing masks, and again, specifically during exercise. I will say we know the importance of why we should wear masks when we're at rest and when we're walking around normally, as far as using that barrier, that facial covering, to prevent the spread or aerosolization of potentially COVID-19 virus particles coming from somebody who may be infected but asymptomatic and not showing any symptoms. The thought is, if you are wearing that mask, we know that that mask does its job and prevents the spread of that virus and actually other bacteria that can be emitted from somebody's mouth through the covering, the facial coverings, based on the certain diameters of webbing and holes that are associated with various N95 masks, cloth facial coverings, medical surgical masks, and they do the job. As studies have shown. Now that is when we're walking around at rest. The difference now becomes when somebody is exercising, what are the stipulations and what are the ramifications, potentially negative ramifications, of wearing a mask while you're exerting oneself. So I will tell you that I would probably think it is okay to wear a mask, whether it be a surgical mask or a cloth facial covering that you can purchase while doing and performing very low intensity type of exercise. So if you're going to go out and walk around the block in your neighborhood, or even ride your bike around the neighborhood, in those instances, definitely wearing a mask is not going to hurt you. And essentially what the debate is people suggest that those facial coverings will trap expired CO2 in the mask, and the individual will then rebreathe that CO2 and causing headaches, often reductions in oxygen saturation, which will then lead to reduced ability to exercise, potentially becoming lightheaded, dizzy, and passing out, and other negative medical issues. I think that we've seen some most recent research disprove that at rest is not necessarily the case and shouldn't impact you like that. And probably at low levels of exercise, you will be okay by wearing a mask and exercising. Now, it's not to say that you won't be uncomfortable, and it will take some time getting used to that mask, and wearing that mask and not being used to having that restriction may make you fatigue a little bit faster and psychologically feel like you're not getting the appropriate amount of oxygen. Safe to say that will probably not be the case at very low levels of exercise. Now, if you are in your own home and you're walking on a treadmill, or you're exercising at your home where it's just you, then by all means, have your mask off if you need it. Now, the debate becomes, if you go to local gyms, what you are doing, what other people are doing, and where you should wear a mask. Again, if there is a mandate from that specific business that's requiring you to wear a mask, then you're going to have to follow the policy, or you won't be able to exercise in the facility. I would say that if you're given the option and you don't have to wear a mask, and you were concerned about should you, very low levels of intensity of exercise, you should be okay. Even light strength training, wearing a mask, I believe you would be fine. Now, certain individuals with underlying cardiovascular or respiratory conditions might want to use some caution when exercising with a mask on. This is something that you should have a conversation with your family practitioner, your personal physician, letting them know what you plan to do and whether or not they felt it was safe giving you a medical history should you exercise with a mask on. So some conditions, there might be somebody with fairly severe asthma, chronic obstructive pulmonary disease, cystic fibrosis, some other pulmonary conditions, and maybe even some cardiovascular, underlying cardiovascular conditions. These individuals might want to exercise without a mask indoors if you are allowed, and some people have exemptions based off of your medical history. But again, if you are going to be wearing and not wearing a mask inside a specific facility, I think it's also prudent that you take into consideration the volume of other individuals that are exercising in that facility and the number of individuals exercising potentially without masks. If you are then going to use the facility at the same time, maybe it might be a better option of coming back and choosing a time when there is an extremely low number of individuals or low volume if you are choosing to not wear a mask, given your specific medical condition. And again, that's with low levels of intense exercise and low intensity exercise, individuals with underlying cardiovascular respiratory conditions. Those of us that don't fall into those guidelines and expect to perform more vigorous, high intensity type activity, there's where the issue comes in, as far as potentially reducing your exercise capacity and the potential for some other medical issues. And the idea is that with this maximal level of activity, we are seeing very high increases in your respiratory rate and the amount of air that we are moving, ventilation rates with maximal exercise. So your breathing frequency at rest might be anywhere from 6 to 10 breaths per minute. And with each breath, maybe you're moving, say, a half a liter of air. Now, when we're at max exercise, we've documented in the lab where people can get their respiratory rates up to 60, 70 breaths per minute, moving very high volumes of air in and out in order to achieve maximal intensity. With a facial covering, and specifically a fairly restricted facial covering, now that becomes a potential issue. Say one thing, everybody should probably be monitoring their heart rates while they're exercising, because if you are trying to stay in a specific heart rate zone, those are probably going to be artificially elevated heart rates I'm talking about while wearing a mask. The mask's job is to provide some level of restriction of airflow. So at maximal activities, when you're moving high volumes of air, probably going to see some potential issues that might pop up. And again, that would be one of those instances where, maybe a little bit less air movement and oxygen movement in, a higher heart rate that will continually pump blood out to account for that difference. You might now see overestimations of your heart rate compared to what level of work that you are performing compared to when we're pre-COVID not having to wear a mask. And I think even individuals that are in very good shape, when being asked to wear facial coverings and masks for the first few weeks or so, performing high intensity exercise, are probably going to notice that they're fatiguing a little bit sooner and faster. Their performance is going to be probably off. Not that there might be any medical concerns, but I think everybody probably needs to be alert and aware of how they feel. You start to feel short of breath, lightheaded, dizzy, a little bit of headache, then you probably need to stop the activity that you're doing, with your mask on, and see if that resolves. And if you're still feeling like that, then you find an area where you can remove your mask and breathe without that facial covering. That might help resolve the situation. But it's being cognizant of potentially how you feel. Everybody, we're our own best judge of how we feel and how our body normally responds to the activity that we're doing. So, and again, the option of if you're going to wear a mask versus not wear a mask, I think low level intensity type activity is fine if you're asked to wear a mask. Still monitoring your symptoms. I think the best option for the choice of mask type is going to be your cloth-based mask that can be washed and reused. Thinking about when we're exercising, the high volume of air that we're moving, we're almost like we're panting, and you're going to get some aerosolization and almost like with the panting, you're going to get that mask wet. The purpose is defeated with those paper masks, surgical masks, medical masks. You get those wet 20 minutes into your workout, and essentially they become useless. The spit and the saliva, and the sweat, block up the pores of those masks that further are going to restrict air movement through there. It's not going to be doing any help as far as protection. So in those cases, it's probably best to make a choice. You get more than one, a cloth-based mask. That still might become wet and moist after the end of your exercise. Maybe you can swap out. And again, you have to choose the appropriate time and be safe when you switch your masks during an exercise session, but then you can take those and wash them, dry them out, and then wear them again for your next exercise session. So I think the idea here is with very vigorous type activity. So individuals training for half marathons, or they're going to go out and do high intensity interval type training work indoors and are being asked to wear a facial covering, probably going to be some issues. And maybe if you're going to be performing that type of activity, you can do that outdoors where you can go sans mask or without a mask. That might be your best option. But if you are absolutely being asked to wear a facial covering indoors, performing that type of activity, that's a little bit more of a concern. And if you're going to have to do that, I think it's definitely imperative that you monitoring your heart rate, you're monitoring your other symptoms. So if you feel the slightest bit of lightheaded dizziness, shortness of breath, starting to get a headache, that you kind of stop what you're doing with your activity, sit down and rest a while, keeping your mask on. But if those symptoms don't resolve, then essentially you try to go to an area where you can remove your mask and breathe in some fresh air, and that should solve your problems. But again, thinking about mask choices, and again, it becomes if the facility that you're trying to exercise in is going to require you to wear a mask. Those are some of the things that you're going to have to watch out for. Again, by yourself in your home, you'd be fine and outside as long as we can social distance and keep, maybe within 10 feet of each other. Going without a mask is ideal. Low intensity type activity, slow walks around the block, riding your bike. I think that you had the choice would be fine, and you wouldn't have to worry about any negative medical concerns with that mask on. Not to say that you might not have some abnormal feelings and reduced work capacity to start out with, but again, everybody should be monitoring how they feel. The choice would be going with a cloth-based mask instead of the paper medical masks. Moving up more vigorous, high-intensity activity, The real concern could be there because we're moving high volumes of air, very high respiratory rates and airflow, and having that restricted facial covering on there now can pose more of a problem than it did, because all the talk was when you were at rest. That's not an issue when you're at rest, breathing 6 to 8 breaths per minute. So at this peak levels of activity and exercise, you have to be more aware. If you're forced to have to exercise with a mask, you definitely want a cloth-based mask monitoring your heart rate and other symptoms. If you're going to plan on doing that type of activity, you can do it outdoors, outside of the heat. That would be great, where then you can remove and not wear a mask. I think if you are exercising in neighborhoods and outdoors, be aware of your surroundings and be aware of other individuals who are exercising, and you want to try to stay out of other individuals' slipstreams, so to speak. So that is, directly behind somebody as they breathe out and they're heavy breathing with exercise. That breath and potential aerosolization of particles, and if somebody was infected, we're going to linger behind them. And if you are trailing somebody immediately behind them a few feet, you could run right through their slipstream in their breath. So ideally, laterally being paired and positioned. If you see that you're coming up somebody around the block and they're also exercising on the same side of the street, opting for crossing the street so that you aren't coming up right behind somebody and running through an area where they've been breathing out, and potentially you're not masked and taking in particles either through your mouth or your nose that might have been infected with COVID-19. And I call that somebody's slipstream. Again, practicing social distancing, staying side by side instead of trailing individuals when exercising outside. Definitely, again, if you're asked to wear a mask, cloth-based mask, and just being more aware of your heart rate and potential symptoms, specifically if performing high-intensity type activities, because again, with those high respiratory rates and moving high volumes of air at peak activity, wearing a restricted facial covering has that potential to potentially cause some issues and reduce the amount of air that you can take in. It's definitely going to elevate your heart rate excessively, more than that same workout without a mask. So again, everybody should understand if they feel lightheaded, dizzy, having a headache, that they need to stop what they're doing, rest for a little bit, see if those symptoms resolve, and then return. Or if they don't resolve, try to get to an area where you can take your mask off and breathe in some fresh air. Feel free, if anybody would like to contact me or email me. My email is semartin@tamu.edu. And again, I'm realizing there is a lot of controversial information being promoted about wearing a mask versus not wearing a mask while exercising. And again, it makes it hard for all of us to make appropriate decisions on what's safe, but I think social distancing and is important, keeping your distance. And then again, I don't think there's a drastic issue with wearing or being asked to wear a mask if you're performing low intensity type activities. Again, appreciate your time. Thanks and giving.